Hi, Ed Marx here, and I want to welcome you to our CEO to CEO Leadership Perspectives discussion. I'm thrilled to be with two of the top leaders in healthcare and listen to what they have to share with us today regarding leadership, and especially in this day and age. So we're going to jump right to it. This is live. So the reason we do it live is two reasons. The main one is to engage with you. So you all know how to do this. You've done it before. On your screen, you can enter questions. I will moderate those questions, and you enter questions. We'll definitely try to answer as many as we can in the 30 minutes that we have allotted. So please, at any time, put in your questions. I am monitoring them, and we'll get to them. We're not for a shortage of questions, that's for sure, because everyone wants to hear what's on the mind of Dr. Cosgrove and Russ Branzell. So I will save the long introduction by giving a one-sentence introduction to each. First to Russ, then to for Dr. Cosgrove, and then really get going, turn it over to them, let them introduce themselves and ask questions. So Russ, longtime CEO of Chime, but also CEO of some other organizations, a longtime CIO as well, and a personal friend of mine, and just a consummate professional. And Dr. Cosgrove, one of the best CEOs in healthcare. I had the privilege of my career highlight as a CIO is serving with Dr. Cosgrove at the Cleveland Clinic. So with that, we're gonna jump right in, and they'll introduce themselves when they answer the first question. So the obvious question is, do you think of leadership differently today than you did 3 months ago? Has COVID shifted the leadership equation? Dr. Cosgrove, we'll start with you.
Well, thanks very much. I'm delighted to be here. First of all, I think that leadership has not changed. I think the requisites are the same. I just think they're emphasized. I think the importance of communication from a leader is much more important than it ever has been before. And I think that's always true in times of crisis. Leaders have to step up, and they have to communicate, and they have to communicate in every imaginable way and by every media they possibly can find to do that.
Great. What about you, Russ? Thoughts?
So I think a similar answer to Dr. Cosgrove, but maybe put a little different way. It's easy to lead during good times. And I was reminded, one of my peers or one of my mentors for many years reminded me when I first stepped into a CEO position. He said, Russ, I don't pay you to lead during the good times. I pay you to lead during the difficult times and to make difficult decisions. And I think that's probably what we're seeing right now is during these really difficult times, it really does delineate out the good leaders that can make decisions with scarce information and really try to lead an organization through difficult times. And so, though I don't think the leadership principles have changed at all, I do think there are stressors on leaders right now that help some rise maybe a little bit more than others.
Let me just pick up on something you said there, because I think it's very important. One of the things that leaders never have is all the information. And that is always a difficult situation because you have to make decisions with imperfect information. And that is the stress on a leader. If they had all the perfect information, making decisions wouldn't be difficult at all.
That's true.
Yeah, again, I'm going to sound a little cliche here for you, Ed, as you think through this and we go through this time together. But one of the great quotes I heard was that sometimes you just have to make decisions and then make them work or make them great. If you wait to make great decisions, you'll never get there. And I think that's the situation we're in now. I spent time with probably hundreds of people on the phone. The people that are doing well today just made decisions at the very beginning and have tried to adjust and make them go well during this period of time.
Yeah, you both bring up really good points. And now you have the advantage point, as I do, where you're not necessarily in the line of fire directly. So you're able to take a step back. And I know many of our listeners, 70% of our audience today are from the C-suite. There's many CEOs listening. And what would your advice be? Because you have the benefit of not having to deal with bullets flying overhead, but nearby. So what sort of advice would you give? If you put yourself, like Dr. Cosgrove, you put yourself back as the CEO of a large health system or small hospital for that matter, what would you be doing? Is your advice?
Well, I think one of the really important things is you have to speak truth and reality to people. And sometimes the news is good, sometimes the news is bad, but it has to be true. And if you, in fact, have bad news to give, you have to give them the news, and then you have to give them hope for how you manage going forward. I think one of the other really important things, and I learned this really the hard way from my personal experience, is you have to be humble. And the humility comes through to people, and people will listen more. And if you are not arrogant and you are humble and you say, in the best, to my knowledge and the best that I can scope out this, this is how I feel about it, and this is how I see the situation. And I've gotten advice, and I am going to work the best I can. And this may be the really tough facts, but these are the facts, and this is where we're going to go. And that humility gives you credibility, because no one expects that you can be perfectly sanguine about all these sorts of things. People just won't believe you if you think you are.
Yeah, that's good perspective. Anything, Russ, that you might add along those lines?
Yeah, I definitely agree with the concept of humility. A few things to maybe add to that. And one of those is kind of the perspective of a senior leader, especially a CEO, is you are often in that position, in a position of vulnerability and in many cases isolation. And, I was told, once you become CEO, you're going to realize it's one of the most lonely jobs in the world. And you often feel very vulnerable in that position. And so I think a couple of things. One, you do need to lean on your people that are very smart, leaders you get to work with every day, and really try to pull the best out of them during this period of time. Sometimes even to the point of stress, where you're pushing them to the very edge of what they're capable of, because you have to during these periods of time. And then the other part of this is truly in a point of transparency. You've got to have peers out in the industry, because you can't often have them in your own organization. So peer-to-peer CEO relationships or others that you can lean on during this period of time, where you can be vulnerable, you can be transparent, and you can spend time and say things like, this situation's come up and I have no idea how to deal with this. Matter of fact, I really don't even have the information to be able to think about this. And you can lean on other people and have networks of people during this time. By the way, you don't create those in the time of panic. You should be creating these 6 months, 6 years, decades sometimes in the case. And I know Dr. Cosgrove, I'm sure, has huge networks of people out there you can lean on. But the opposite is now true for both of us. Those networks of people now that are still on the front line, I'm sure he's experiencing this. I don't think a day goes by where I don't get several phone calls from frontline leaders saying, here's the situation I'm in, any advice? And that comes with a lot of pressure to help somebody on the very front lines right now, dealing with some of the most difficult things they've ever dealt with.
So let's switch gears a little bit. So we're in the age now of virtual care, obviously on steroids, right? We knew that this was the direction we needed to head. I know personally, my service with Dr. Cosgrove, Cleveland Clinic, one of the organizations across the globe leading that way, the direction. And now it's gone, up like a hockey stick, appropriately so. Is there a different skill? So that from a C-suite perspective, CEO, not CIO, but CEO or other member of the C-suite, is there a new leadership skill, or does it go back to the first question we talked about? Is it the same skills, just different emphasis? Is there new skills required? What would your recommendation be to CEOs who, many of which, may not have really pushed on this area like you did, Dr. Cosgrove, at the clinic, but now need to? So what advice would you give those CEOs about how to embrace this new era? And, has leadership changed, or do you need to modify some way?
Well, I think it's just put a point of emphasis on what's happened here. As you probably remember, I've been pushed really, really hard to get doctors interested in virtual medicine. And we got all the way up to 2% of the visits at the beginning of this year. It's now 75%. And it's incredible what's happened. And interestingly, the pushback was from two aspects. It was A, the doctors, and B, patients. It took a very huge change in society to make that happen. But now it has happened, and now I think we have to take advantage of it. Now, one of the issues about leadership is you have to provide the technology and the support for people to be able to do that in a fashion that is appropriate for the interaction between doctors and patients. So I think that's the responsibility now, but I don't think actually the leadership has changed. I think we're learning new techniques, new applicability. I think you have to be open to encouraging people to do that. You have to give them the technical capabilities of doing that. And I think you're going to have to direct them the things that you can use and you can't use. There's a lot of different ways right now that you can do virtual care. Some of it I think is appropriate, some of it is not. And I think part of the issue is going to be sorting out which is and which isn't. But that's leadership skills to be able to be open to new ways to do it and to guide the path that is appropriate for the use of those technologies.
Yeah, so this is live. So if you have questions, please feel free to enter those questions and we'll be happy to address it. We're going to switch up based on some feedback. I'm going to switch up a little bit here. And so, Russ, let's ask Dr. Cosgrove a question or two from getting a CEO perspective, or what would the CIO like to say to the CEO or ask the CIO? And then we're going to reverse that and ask Dr. Cosgrove to share with us what he would like to see from IT leaders. So Russ, we'll tag team here on Dr. Cosgrove, representing IT or CIOs.
Yeah, no pressure there at all. Thanks, Ed. Appreciate that. So, I think the question I think many of our CIOs are going to ask, and are asking even myself right now, is, so we're entering into this new era where we are in financially difficult times, yet we need to make the next level of big investments to capitalize on the change that's occurred and to take things to the new next level of whether it be virtual care or care in the home, whatever the case may be. How are we going to be able to do that in the same period of time when people are being furloughed, positions are being eliminated, and at the exact same time, now is the perfect opportunity to capture the market in a new business model?
That's the $64,000 question. And just to put it in perspective, we knew going into this that 20% of the hospitals in the United States were running in the red. We know that you've read that New York Presbyterian is going to lose $1 billion this year. We know that Cleveland Clinic is losing $100 million a month. So there is incredible stress on the system. So the difficult technical decisions, the difficult financial decisions are going to be where you place your bets going forward. I personally think that if you look at the experience in China, where they went to a huge virtual care, roughly a third of those visits have continued. And I firmly believe that it's going to be in the best interest of healthcare delivery systems to continue to support virtual care in any way that they can. And now that it's being reimbursed, that changes the perspective on this enormously. It also, think about what it's going to mean, just for example, to a hospital system. It's probably going to mean less investments in parking garages, less investments in physical facilities, doctors' offices, etc. It's going to there's going to be a lot of startups that are going to start doing things like home physical therapy for instead of going to see somebody in their physical therapy, there's going to be a big push on the virtual prescription writing. I think virtual ICUs are here and going to only expand. So the limits on this are enormous, and I think that this is one of the places where people have to invest. Now, similarly, I think you're going to have to partner. I don't think we can do all this by ourselves. And so the selection of partners, particularly when you start thinking about the potentials of machine learning and AI, I think this is not in the natural wheelhouse of healthcare providers. And I think partnering is going to be essential to do. And there are lots of people out there who'd like to partner with you. So a lot of tough choices to be made. But the allocation of finances is going to be one of the preeminent ones. And I just think it's going to change where we put our money. I think more and more to the digital age.
No, that's great perspective. So, Dr. Cosgrove, in the same way, what would you, as representing CEOs, want your CIOs to know, in addition to the partnership one? I think that's a really key one. What else would you want us to know and be doing in this new era?
Well, first of all, I think that this is going to wind up being a change in, they're going to have a consolidation of hospitals. I think that just the financial strain on a lot of hospitals is going to cause consolidation. I think right now you're going to see increasing number of physicians become employed, and they're either going to be in big groups employed, or they're going to be employed by hospitals. And then the other one is cybersecurity. You know, you stop and think how few hospitals that there are in the country that have the intellect or the financial capabilities of providing real serious cybersecurity. And that's going to be a bigger and bigger issue as we go forward. So I think those factors are going to drive consolidation. They're going to drive employment of physicians. And I think your CIOs got to understand that those things are coming and help you map out the plan on how you're going to do that.
Yeah, and I think this is a perfect way to explore this moving forward. In talking to a lot of different leaders right now, I couldn't imagine a year from now going to my CEO as a CIO and say, by the way, here's the new project. It's going to take me 12 to 18 months and I need X millions of dollars. They're going to look at it and say, well, last time you did it in 3 days and you did it on almost no money. So the question will be for the average IT leader out there, how am I going to create rapid programs to onboard, to accelerate, to change the business, to be one step ahead of my CEO in ways that even the CEO can't think right now, because the CEO moving forward is going to make decisions in days, not weeks, months, and years. And you're going to have to move left and right in a moment's notice. So what does that mean? Not being tied to traditional technologies and data centers and ways of doing businesses. You're going to have to think cloud computing, different types of partnerships, ways of getting out of certain lines of business. You know, whether that means selective sourcing or outsourcing certain portions of business, or just getting out of it completely. You know, we did a survey a couple of years ago in Chicago. We tried to figure out, and we stopped at about 40 different data centers just in the Chicagoland area. And there's no strategic advantage to a CEO on owning a data center. So the question is, how do we create a model moving forward where when the CEO says we need to go here, you're ready to go, and you're ready to go in weeks. And as long as the CEO and the C-suite can remove the obstacles, just like we just did, and create the rapid adoption, then we can start moving things that quickly. Onboard a physician practice in days, not months and years. Put a new hospital on a system in days and weeks, not years. You can open a hospital in a city park in New York in days on a full EMR. You better be able to move a hospital in about the same amount of time moving forward. I just don't know a CEO that's not going to expect that moving forward.
Yeah, I couldn't agree with you more. And I think the two things I would pick up on, first of all, clearly, I think it's time to move to the cloud for any number of reasons. It just gives you more capabilities faster, and everybody having their own data center, I think, is almost an anachronism for the amount of data that we have to store and the facilities to do it. And by the way, I don't think any of us really, and that goes back a little bit to cybersecurity, I don't think any of us are really experts in running data centers. I mean, that's just not what we were trained to do. We're supposed to be looking after patients and not running data centers. I think the second thing that I would point out to, I think the landscape has changed enormously because a lot of the barriers, for example, practicing across state lines for doctors, I think those are going to become very different. I think the FDA is going to be very different. I think the emphasis is no longer going to be so much on, worry about monopolies in healthcare, et cetera. I think from the federal agencies, I think they're going to have a lot more important things to worry about than that. So the ability to move rapidly, I think, is going to move enormously. I'm always reminded, and in fact, every time we build a building, I ask them how long it was taking, and I reminded them they built the Empire State Building in 18 months.
Yeah.
I think that's the sort of speed that we're going to be expected to move at.
Yeah, so along that line, so we have several questions. We have 10 minutes left, so if you have other questions, please drop them in. We'll pick up on them. So some of that rapidity that you've been both speaking about was supported by numerous relaxations, right, of rules and regulation and, frankly, bureaucracy. So how do you see that? Is that going to be extended, do you think? Is that going to be the new part of the new normal we'll see from the government? Because right now it's kind of easy to move fast, but what about in the future? What are your thoughts on that?
Russ?
Yeah, I'll jump in first. I do think we're going to backtrack a little bit on a few things such as security and privacy. I think there was enough leniency during this period of time to get what needed to get done, and I think you are going to see that go back to some degree of strengthening or at least reevaluation to ensure we're doing what we need to do. But as Dr. Cosgrove talked about, you talk about state-to-state licensures. Now you have care being provided by a physician. Well, you can't go back on that. And the analogy of once the toothpaste is out of the tube, you don't put it back. I think that's true for a lot of this. I do think you're going to see some formalization. Some are going to want more government regulation around certain things such as care. But I think it's our hope and goal that we won't. Now, what I'm hoping is these things don't go from temporary relief back to some other process, but rather, people are going to look now of how do you capitalize on these gains, reduce costs, improve safety, provide access, and we formalize this into law where needed to, or in some cases, remove the restrictions that are there in place that are inhibiting it even today to make this easier to continue on and provide the care we need to. But boy, I hope we don't go back at all on things like telemedicine, virtual care, home care, whatever the case may be.
Yeah, I think also, I think there's a couple of things. We're going to have a balance that's going to have to strike a new balance between personal privacy and using the data for major understanding of healthcare. And that is, you now realize that you can use the data to understand epidemics, and that sometimes flies in the face of privacy. But as we're going to try to deal with these things in the future, we're going to have to find a new balance, and everything just can't be totally private information anymore. We have to use it for the greater good of the society. And I think that is going to be sort of a new set of things that we're going to have to deal with. I fully expect that we're going to have some going back to where we were previously. I don't think it's going to get all the way back to the bureaucracy we dealt with, but I think we're going to see some of that. There's one financial thing I'd like to point out that I think is going to reshape healthcare in a very major way. As people lose their jobs, they're also losing their private insurance. And private insurance has been what has wound up cost shifting to the Medicare, Medicaid individuals. And so more and more people are going to be relying on some sort of federal or state government assistance for their healthcare. That is going to change the finances of healthcare in a very major way, and has the potential of really changing, what is expected across the country in a ways that we thought were impossible 4 months ago. So I think that is going to be a huge factor, particularly, when I got 30 million people who've lost or filed for unemployment. And I don't see that is going to slow down any. I expect it will go even higher. So, we're going to see the same sort of changes coming out of this as we saw coming out of the Depression. And one of the things that I have been a proponent of is I don't think you can just give people, and this is an opportunity, I don't think you just give people money. I think you have to provide them with a job. And there is an opportunity that was very much like the WPA during we brought us out of the Depression, that people got a job and they got paid and they gave service and provided things that helped society. And what we've been proposing, and hopefully there's going to be some action out of Congress with this, is that we create a healthcare ready reserve, which could be people that are trained very much like corpsmen are trained, which only takes 14 weeks to train a corpsman. They have enormous capabilities. We have a shortage of 100,000 doctors in the United States. Doctors are going to have to increasingly do doctor work, and we need people who are going to have some sort of medical skills, technology, etc., to pick up that sort of work, and who can serve much like the National Guard does in a time of emergency, like a flood or a tornado or an epidemic. So so it serves multiple purposes. And instead of just giving out money, let's get something. Let's provide jobs. Let's get some people that are trained that will help us in the future. And I think that is one of the opportunities that we have as a nation right now.
That's very well said. We have 3 minutes. We have way more questions than we can handle now, but I'm going to try and combine 2 or 3 questions that came into one. And really about the future of virtual care. We talked about the statistic at the clinic from 2% to 75%. What do we see happening with some of the procedural care that's normally in the hospital? Is it ready to move out of the hospital? And then telehealth, might work well for you and I because we're tech savvy, but what about other generations? So how would you approach that? And realize we're down to about 2 minutes. So let's just ask Dr. Cosgrove to answer that one.
Well, thank you. Well, I think, we're going to be amazed at the way that virtual care is going to be able to be used. I think people are going to try and be kept at home and deliver care at home. And I'm always reminded of an orthopedic surgeon who ruptured his Achilles tendon, wound up seeing 23 patients in his clinic from home in his pajamas, scheduled 3 operations, and saw the rest of the patients post-op. People love their psychiatry that way. They love their dermatology that way. There's an awful lot of things you can do that we just haven't applied to. And stop to think about older people. Why should they not be looked after at home virtually? And I think ultimately we're going to turn every television into a 2-way communication system.
Yeah, that's very well said. I'm going to just end with this. There's a couple other really good questions I would love to get to, but we're limited time. We want to respect everyone's time. So I'm going to ask both of you a question and looking for a bullet type response. Before I get there, Dr. Cosgrove, one of our former caregiver colleagues from the clinic, reminds us, as always, it's all about putting the patient first in all of these technologies, and that person's absolutely correct. And I think that should go without saying. So, what's the one leadership skill that you wish you would have learned earlier? So one leadership skill you wish you would have learned earlier, and why, and then we'll wrap up.
Well, me personally, I think speaking communication. I think that if you cannot speak articulately, it's very difficult to lead.
Great. Russ?
Mine would be in the same vein, but a little bit of the opposite, which is active listening. One of the things I did, especially as a young military officer and others, is you're expected to lead and talk a lot, and you don't get taught to listen a lot. And I think that's one of the things that, as a good leader, especially, you get to spend time listening to those around you. Great leaders like Dr. Cosgrove and yourself, Ed. You can learn a lot by just sitting still and being quiet.
You just have to use them proportionately.
And the reason I asked that question, because obviously people want to know, what can I learn? Well, there's two things that sometimes it's best to learn from other people's experience, and you both as great leaders, that gives them some good insights. I want to personally thank you for participating today. I want to thank people for listening and being engaged. Lots of questions, lots of people who've registered, and of course we'll post this online for others who could not join us live to listen to and to see very profound observations by these key leaders. I won't keep going. You know how I feel about you, and I think the rest of the world does as well. So I think on the last slide, we have a couple upcoming webinars. We have Dr. Dave Chotsky, former colleague of mine at New York City Health and Hospitals. He's deep within what's happening there, sort of the epicenter. We continue our digital transformation series with Patty, and of course, Dr. Cosgrove. I didn't mention this, but Dr. Cosgrove wrote the foreword for our book that's coming out on healthcare digital transformation. We delayed it purposely by about 6 weeks to add in some pandemic-specific items in that book, because we believe pandemics will be with us for some time, not just COVID, but other things. And then there's some more webinars coming up. You can read it. Thank you again. Thank you both, Dr. Cosgrove and Russ, for joining me today. Thank you, everyone.
Thank you. Take care. God bless.